Here's a disease that is both potentially life-threatening and difficult to diagnose. Let's get into it. I'm referring, of course, to the pulmonary embolism. This is a blood clot in the lung, specifically a blood clot in one of the pulmonary arteries. Now, you might be thinking, blood clot, what's the big deal? We get blood clots all the time. You get them with a bloody nose. The bleeding stops thanks to blood clots. And yes, this is true. And in this case, blood clots are desirable. They can even be life-saving by preventing blood loss. However, if blood clots end up in a large vein or artery, they can cause problems. And in the case of clots in the pulmonary artery, they can even be life-threatening. So how does this happen? Most commonly, the clots don't form in the lungs. They form in the legs, especially when the legs are immobilized, like during a long car ride or plane flight, or after surgery when you're spending a lot of time in bed. This causes blood to pool in the veins in the legs where the clots can form. Then the blood clots find their way to the heart and eventually get lodged into arteries in the lungs. Now, before we get really freaked out about this, let's keep in mind that this disease is pretty rare. People go on long plane flights and long car rides all the time. We undergo surgery and most often don't end up with clots in our lungs. So what can cause these to happen? What increases the risk of blood clots? A big one is cancer. This is one of the risk factors for developing pulmonary emboli. Cancer puts the body through extreme stress and inflammation, and as such increases the risk of blood clot formation. The risk is well known, so well known that if somebody develops a pulmonary embolism and there's no known cause for it, the first questions doctors will ask is, are we missing cancer? Okay, so at this point we've gone over what a pulmonary embolism is and what increases risk for getting one. Now let's dive into how doctors diagnose this. And spoiler alert, it's not easy. You can't hear a pulmonary embolism with a stethoscope. You can't see it on a chest x-ray or even an EKG. Routine blood tests won't pick it up either. Indeed, many of the tests that are commonly performed in urgent cares or emergency departments will not detect a pulmonary embolism. This is why the disease is so scary. It's both potentially life-threatening and easy to miss. So how does a doctor make the diagnosis? Well, it starts with the medical interview. We'll ask questions like, have you recently been on a long plane flight? Do you have a history of cancer in the family? Have you recently had surgery? Then after the interview, we'll conduct a thorough physical examination, paying close attention to rapid heart rate or swelling in the legs, both of which may increase suspicion for a pulmonary embolism. Then a doctor will likely order a blood work, in particular a D-dimer. Here's the thing. D-dimer is a test that is what we call sensitive but not specific. If it's negative, it's pretty good at ruling out a pulmonary embolism, but if it's positive, it really doesn't mean much. A lot of things can cause a positive D-dimer. And I'll be honest with you, most people in the emergency department, whether they have infections, traumatic injuries, heart attacks, cancer, whatever, they're going to have a positive D-dimer. So the test isn't conclusive by any means. The way you really make the diagnosis is with CT pulmonary angiography. This is where you go through the CT scanner. It looks like a big donut and it takes very detailed images of the lungs that can detect clots in the arteries. Flip side to this test is that it requires a lot of radiation, way more than a simple chest x-ray. Furthermore, it requires IV contrast. Contrast can be harmful to the kidneys. For these reasons, doctors don't like ordering this test unless they feel it's truly necessary. It's not a test that just gets slapped onto anybody who shows up in an ER. If the CT pulmonary angiography shows a clot, I've got some good news. There are treatments available. Clot-busting medications like TPA can be given, but the mainstay of treatment is with anticoagulation medication. Okay, there you go. There's a very quick introduction to a very feared diagnosis that all internal medicine doctors are aware of, and it's always on the back of our minds anytime we care for somebody who complains of shortness of breath or chest pain, especially if that individual has a history of immobilization or cancer. If you like health science related videos like this, feel free to hit the subscribe button there or check out another video here, and I'll see you guys next time.